What we know right now is that this HR1, for people who doesn't know what it is, this is the big, beautiful bill for Donald Trump that is cutting a lot of money for the counties, for states, everything. And Santa Clara County is being affected, especially the hospitals and traumas and emergency rooms and overall the hospital, I mean, different sectors in the hospital are being affected. But in last minute, the county, the board of supervisors decided to put a proposal, which is a sales tax increase for fifth, eighth of a dollar. And this is, can you give us an overview what this proposal is and what this is supposed to do? Please, can you explain us?
Absolutely. If it's okay, I'll start by backing up a little bit to HR1. HR stands for House Resolution, and that's just the number that the bill was given um, in order to go through the legislative process. Yes, Trump calls it the big, beautiful bill, but it really is a huge disaster just around the corner waiting to happen. HR1 makes significant cuts to many, many services, social services that folks all across the country rely on for healthcare, for food access, for housing supports, for public health. This bill is basically directed at making life even harder for people who are poor, people who are already struggling. County government is responsible for providing most of those services. We are the safety net, and our responsibility is to take care of people who are, for a variety of reasons, not able to thrive in our community without some additional support. Something that is, so that's happening in counties across the country. A piece that is unique in Santa Clara County is that we operate a very large public health system. In fact, it's the second largest in the state after Los Angeles. And our public health system consists of 4 hospitals, 15 county health clinics, and then a number of other community clinics that we provide some funding for. Of our budget, which last year was about $12 billion, and I know that sounds enormous, but almost all of those dollars have to be strictly spent on some specific thing. About $3 billion is what we have received in the past from the federal government to reimburse our hospitals and clinics for care that's provided to people who receive Medicaid or Medi-Cal for their health insurance. When this horrible bill was passed, it put into place a series of reductions to that Medi-Cal, Medicaid coverage that are going to impact people who receive Medicaid, but they are also going to impact other people in our community, because what will happen is that as we get fewer dollars from the federal government to reimburse for healthcare, we're going to have to take other money from our county budget to backfill those expenses, which means less money for other vital services in our community. It really is an existential challenge for our county right now. So you ask about the timing and you use the words last minute. The bill was just passed, I believe, in May or June. The county government takes somewhat of a recess during July. And at our very first meeting in August, when we came back, in fact, we scheduled a special meeting prior to the regular first meeting in August, specifically so we could consider putting a tax on the ballot. We had to do it that quickly because our county is going to have a special election this November due to the early retirement of the county assessor. The county assessor was elected 2 years ago. His term should end in 2026, but because he retired early, the county by law is required to hold an election this November. So we wanted to make sure that this sales tax measure would make it onto that same ballot so that we wouldn't have to wait until 2026.